Assalamu alaikum. In this video we will discuss chronic dacryocystitis. What is the definition? It is the chronic inflammation of the lacrimal sac. It is the chronic inflammation of the lacrimal sac. It is caused by impaired outflow of the tears that leads to the stasis of the tears in the lacrimal sac, and secondary infection occurs by the low virulence organisms leading to dacryocystitis. Now, what are the clinical features? It is more common than acute dacryocystitis. Second is constant watering from the eye is observed. Third one is swelling in the medial canthal area is seen. Fourth one is regurgitation test may be positive. What is it? When we apply pressure on the lacrimal sac, the mucoid or mucopurulent discharge comes out from the puncti. Fifth one is mucocele formation that may occur if the sac becomes dilated after blockage of the common canaliculus. Now, what is the treatment? Treatment consists of dacryocystorynostomy, that is DCR. Dacryocystorynostomy. Now we have two approaches. First one is external approach DCR, and the second approach is endolaser DCR. This is all about chronic dacryocystitis. Thank you.